Hi everyone, Stan here. Today I have Dr. Mo from Revision, who's also my surgeon for my ICL surgery last year. And I'll get Dr. Mo to introduce himself.
Thanks, Deanne. I'm Dr. Mo Zi, commonly referred to as Dr. Mo. I'm a refractive laser vision correction surgeon here at Revision Laser and Cataract. And what we specialize in is vision correction procedures, including laser and ICLs. We have set up the clinic since 2018. I actually trained in the UK, but came to New Zealand, but now call New Zealand my home. I'm fellowship trained in laser vision correction as well as anterior segment procedures, and it's a pleasure to be here.
Awesome. So Dr. Mo has done thousands of cases of refractive surgeries, and today we're going to discuss some questions commonly asked by a lot of the patients who are interested in getting laser surgeries. So one of the most common questions I get asked in clinic is LASIK safe?
Great, thanks, Deanne. And it's a very commonly asked question. What I usually say is LASIK is the most safe medical procedure that we know. It's something that's been around for decades and decades. More than 30 million people have had laser vision correction. As far as we know, there's no single report of blindness after laser vision correction, which is fantastic. And I can't say more about the safety of the procedure than having had it done myself. I had my surgery done about 12 years ago. And typically I say 99.99% of the time, with appropriate pre-operative and post-operative care, the results are excellent.
So it's very good to hear that laser has got good safety profile. But what about the outcomes of laser surgeries?
Fantastic. Well, there's a lot of data, a lot of research regarding the outcomes of laser vision correction. Perhaps I can talk about a study that I was involved in 2014, where we looked at the outcomes of laser vision correction using the LASIK technique. And we pretty much found that everyone had a 20/20 vision with both eyes open. And what I tell my patients usually is the day after surgery, within hours of having had the procedure done, pretty much everyone is 20/20, and many people can go back to work within the kind of next day or two following the procedure.
Wow, that's very good to hear. I hope those who are worried about taking leaves after the surgery can be a bit more reassured.
What I often talk about is my own experience, and that is that I had my surgery 12 years ago on a Saturday, and I went back to operating on the Monday, which kind of tells you about the little downtime required to recover from the procedure.
What about the common side effects that patients get after the laser surgeries?
Sure. Well, any surgery, Deanna, as you know, has a small degree of risk associated with it. There are common things that I typically discuss with every patient. The common things being common is that I usually say the laser is very sophisticated, highly advanced, but there's a healing process involved with laser refractive surgery. And I typically talk about a 1% chance of needing to do an enhancement procedure where we go back and do a little bit more laser treatment to get the numbers perfect. We typically talk about a care package whereby if that were to happen, there would be no extra financial cost to the individual. And very commonly after laser vision correction of any sort, there are some dry eye related symptoms, and it's normal for individuals to feel that they have a bit of dry eye in the early few weeks or months after the procedure, typically treated with dry eye drops. And there are really uncommon potential side effects that I have not really experienced in my own career, which we can potentially talk about later.
Okay. What about the risk of infections after the surgery?
Yeah, that's a very good question. And any surgery's got a small degree of infection. What we see when we look at the research body or the literature available is that the risk of infection is anywhere between 1 in 3 to 4,000 cases. And one thing that is often shocking to individuals is that the risk of infection after 1 year of contact lens use is actually already higher than the risk of infection after laser vision correction. So many people come in very happy to wear their contact lenses for long periods of time, perhaps not take great care of their contact lenses, and they are surprised to know that the risk of infection after surgery is much lower.
So the other common question I get asked a lot is there an age limit for laser surgeries?
Great question. So we typically want the prescription in the eye to be settled and stable before we do laser vision correction. And typically we don't want to do laser vision correction in individuals under 18. What we find commonly is that the prescription is not stable until you reach your early or potentially mid-20s. But if your prescription is stable, I have actually done the procedure for individuals as young as 18. It's much more common for the cutoff of 21 to be used. In terms of an upper age limit, there really strictly isn't an upper age limit, but we typically won't do laser vision correction in individuals who are in their mid-50s and beyond, because there may be potentially better procedures that are more suitable for them.
And how long do you think that the patient needs to have their prescription stable for before they can get the surgery?
Sure. So stability is an important paramount preoperative consideration for laser vision correction. Obviously, we do not want to do laser surgery on someone whose prescription is changing.
Yeah.
But one thing that I often find people are getting worried about is small changes in their prescription.
Yeah.
Typically, if your prescription has been stable for the past 9 to 12 months prior to the procedure, you're a good candidate. But because the prescription testing process is somewhat subjective, we find that plus or minus 0.50 diopters of SIL or myopia or hyperopia, which is long-sightedness and short-sightedness, is well within the stability limits that we're looking for. So if you've had 2 eye tests within a period of a year where the numbers are roughly looking equal, then you should be a good candidate for laser vision correction.
Yeah. So what about vision after laser surgery? Do you think it gives better vision or worse vision compared to with glasses?
Great question. With modern laser techniques and laser devices, we have the ability to correct the subtle irregularities in the optical system of the eye. So we should in theory get better vision after laser vision correction compared to glasses or contact lenses. I as a surgeon would want to always under-promise and over-deliver in terms of the outcomes.
Yeah.
So I typically tell individuals that they should get the vision they have in their glasses, but we always aim for more.
And I like to share that because I had really high prescription before my surgery, and when I was wearing glasses, because with really thick glasses you need to look through a specific point to get the perfect vision. If my glasses down or up, or I'm looking on the round side, then my vision is not perfect. Or same with contact lenses, because I have a high astigmatism as well. When the toric lenses, they turn on my eye, the vision is not always perfect.
Sure.
But now I have the perfect vision 24/7, so that's very good time to have.
Fantastic to hear your personal experience, absolutely.
Yeah. So those who have been watching my videos know that I have a special interest in dry eye, and I get asked a lot about if they have dry eye, can they still have laser surgeries?
So dry eye, as we've already discussed, is pretty much part of the recovery process after laser vision correction. Pretty much everyone will end up with some degree of dry eye. What we really want to do is make sure that the individual does not have a significant degree of dry eye prior to the surgery. Because if that is the case, this individual would benefit from treatment before laser vision correction. Most individuals don't have a significant degree of dry eye, so that they can expect the eye to be somewhat dry in the first few weeks to months after the procedure. But pretty much all the studies show that after about 6 to 12 months of waiting after any form of laser vision correction, their dry eye symptoms improve back to their baseline levels.
Yeah.
Now, there are different laser techniques where dryness is less compared to some of the other techniques available. But on the whole, I tell individuals that they should expect some degree of dryness, and that long-term significant dryness is extremely rare.
Dry eye is a very complicated and multifactorial disease, so they can be caused by many different factors, including computer use these days, phone use these days, and also environment. That all contribute to dry eye. It's not only the surgery.
Absolutely, and I often talk about the fact that many of my clients are wearing contact lenses, and contact lenses can dry out and also cause irritation to the eye. Many individuals report in the long run that their eyes are more comfortable after laser vision correction compared to their contact lenses.
But what about during the procedure? Is laser surgery a painful procedure for a patient?
Sure, that's again a very commonly asked question. That you're awake during the procedure, but we do give you a mild sedative just to relax the nerves. Obviously, having any form of eye surgery can be a daunting process.
Yeah.
But having gone through the procedure myself, you will feel some degree of pressure on the eye for a short period of time. So all in all, it should be a comfortable process, but you might feel some pressure, also cool sensation on the surface of the eye. It's very much doable, and I usually say it's much better than going to the dentist.
And during the procedure, can patients blink?
Great question. So as I've mentioned already, you're awake, but we numb the eyes using numbing drops. And we also use a little clip to hold the lids apart, and this is a very comfortable clip. So patients typically feel less of a sensation to want to blink, and if they want to blink, they actually can't because there's a clip in place.
Yeah.
And you should let the surgeon guide you through the process. I often talk about my role as being the coach through the laser process.
And how long does the surgery normally take?
This very much depends on the type of laser eye surgery that you're having. The quickest version of the laser eye surgery is PRK, which takes about 7 minutes for both eyes. And usually for LASIK, we're looking at 15 minutes for both eyes to be completed.
What happens if I move my eyes during the surgery?
The sophisticated laser systems that we have now have advanced technology, what we call tracking technology. The laser is scanning your eye 1,000 times a second. So it's much quicker and much more clever than your eyes. So you can't really look in the wrong direction. If you do, the laser will stop before your eyes move significantly off center.
What about after surgery? How long do you think people can see clearly after the surgery?
So what I usually tell patients is that they sit up from the laser bed and the world is much clearer already visible.
I think I remember that when I'm sitting facing the window in that waiting area after the surgery, I can just see through the window and so clear. It's surreal.
That's right. It's an unusual experience, but nevertheless, you've just had surgery, the eyes are watery, you're a bit nervous. So whilst the vision is clearer, it's not perfect. Most individuals go home, they take a sleeping tablet, and when they wake up to a much clearer world. And as I've already mentioned, a few hours after the procedure, pretty much everyone is seeing 20/20 on the chart, if not better.
And how long do you think they can go fully recover still to their normal life and work and study after the surgery?
I had my surgery on a Saturday and I went back to operating, which is a visually demanding job, on the Monday. So most individuals can go back to a normal life within 24 hours after the procedure, as long as they're doing common sense things, which is putting their drops in, not doing any crazy activity in terms of exercise, and obviously coming for their follow-ups.
And another question is, how long will my eye hurt after the surgery?
The most common version of the procedure is LASIK. For the first night after the procedure, the eye will be a little bit blurry, a little bit gritty, a little bit watery. It shouldn't really be painful. Most people take a Panadol, if that. The next day, the eyes are much more comfortable. They may be a little bit dry, but there should be no significant discomfort or pain.
So a lot of my friends would want to wear colored contact lenses after the surgery. Would that be a possibility for that?
Absolutely. Once the eye is fully settled and you've stopped taking your steroid drops, there's no reason why you can't wear your colored contact lenses again, as long as you make sure you stick to the safety and the hygiene requirements with contact lenses.
So another common question is, how long does the surgery last? Will my prescription ever go back after the surgery?
If your prescription's been stable, the effects should be permanent. But there is no guarantee in life that your prescription may not change as you age, which is why we want to make sure it's stable before we do the procedure. But if the prescription does change down the track for whatever reason, most of the time we can do an enhancement procedure where we go back and do some more laser fine-tuning to get the numbers right.
A lot of the patients have had their surgeries done overseas. Will they be able to do rechecks in New Zealand?
Absolutely. So when you have surgery done elsewhere, you want to make sure that your immediate post-operative checks are done locally, because the doctor obviously needs to check the eye and make sure everything is okay. But in the long run, if everything's okay in the immediate post-operative period, the long-term checks can be done in New Zealand. So you can actually go back to your optometrist for long-term checkups. If for whatever reason you need to see an ophthalmologist or a laser specialist, we can definitely make an arrangement to see you, but that is usually not required because the process is very smooth and the outcomes are excellent.
And also for those who have done the surgeries, just to know that the surgeries are not to treat myopia. It is only a way to make you see clearly, like glasses or contact lenses. The regular checks of the back of the eye is still very important because you're still at risk of having high myopia even after the surgery. So regular checks at optometrist is very important.
For sure. So most of our laser patients are discharged from our care after about the 6-week period, but we typically say that you should go and have your regular eye health checkup with your optometrist, which should happen on a 1 to 2 yearly basis. So that's where we kind of transfer the care of the individuals back to the optometrist.
So for those who have seen my videos of my experience at revision for my ICL surgery, so that's the surgery I went for because I had a high prescription. I had a -750, -850 in the other eye with high astigmatism as well. So people do tend to ask me, why did I choose ICL, not laser surgeries?
If you've got a good thickness to your cornea and your prescription is relatively low, then you should be a good candidate for laser vision correction. If you have a high prescription like yourself, and usually the cutoff is about 8 diopters of myopia, Or if you have a thin cornea or an irregular cornea or a weak cornea, then the ICL procedure will be a much better procedure for your eyes because we will not be removing tissue using the laser to reshape your cornea. There are other circumstances as well where ICLs may be better, and typically that would be for individuals who are into contact sports, particularly martial arts, because we really don't want anyone with a significant risk of being hit in the eye having LASIK, where we create a flap, or SMILE, where we create a lenticule. So the other one that we've touched upon before is significant dryness. So if the eyes are significantly dry before the surgery, then ICLs will likely do better than laser vision correction.
What about the risk compared to laser surgeries? What do you think of that?
So I usually tell individuals that if they're a good candidate for laser vision correction, then it makes much more sense for them to have laser as opposed to ICL. There is a financial aspect where ICLs are much more expensive than laser vision correction, typically double the cost. But also the ICL, or the implantable contact lens, is placed in the eye rather than laser working on the surface of the eye. So what we call an intraocular procedure as opposed to an extraocular procedure. And as a rule of thumb, you want to avoid operating in the eye if you have the opportunity to only operate on the surface. But other than that, ICL procedure is very comfortable as well. The recovery process is quick, but because we dilate your pupil to do the actual procedure, it may take a day or two for that pupil to come down and for your vision to be optimized. The other thing that I usually tell my patients is that they do need ongoing care with ICL surgery, where they need to come back and see someone who's experienced with the ICL procedure to do annual checkups.
So more expensive is not always the better option. Definitely check with your doctor before the surgery to know about the risks and to do some study yourself before the surgery.
For sure. And unfortunately, no insurance company covers the cost of laser eye surgery in New Zealand, or if they did, it was back in the early days of laser vision correction, so you need to have a time machine to go back and reclaim the cost of your surgery through your insurance company. But one thing I might finish off on, Deanne, is that the cost of surgery should not be a barrier to having the actual procedure, because in the long run, if you compare the one-off cost of surgery as opposed to many years of wearing glasses, contact lenses, solutions, and the rest of it, many times you actually realize that the procedure is actually more cost effective than just having optical correction.
And most importantly, for those who don't want to wear glasses like me or contact lenses, it's a very unique experience and it definitely changes your life.
Yes. So we're in a very lucky field. We're very privileged to be able to provide a procedure that's quick, comfortable, but also so enhancing in terms of the change that it provides to patients' quality of life.
All right. I think that's all for today. Thank you, Dr. Mo, for your time today. And I hope that answered a lot of the people who are interested in getting the surgeries done. So thank you again.
Thanks for having me.
Thank you.